So, neuroplasticity is the brain's ability to change, adapt, and strengthen its connections through practice and experience. So, for example, I am bilingual, and I know sometimes I know exactly what I want to say, and it's at the tip of my tongue, but I just can't remember what I'm trying to say. So, a lot of times, what I will do is I will say something describing what I'm trying to say. Um, but the more that I practice and the more that I repeat it, have the same conversations, the easier it comes for me to find those words. Um, so that's my brain strengthening those language connections through practice, and that is what neuroplasticity is. So after a stroke, the challenge is much greater because some of the brain's language pathways have been damaged. So the person still knows the language, but assessing those words becomes much harder. Therapy gives the brain repeated opportunities to strengthen those connections and build new pathways so communication can improve. Three neuroplasticity principles that will guide my therapy would be repetition, salience, and use it and improve it. So, repetition means practicing the language skills over and over for the brain that needs that repeated practice. Salience means practicing words and conversations that are meaningful and important to the patient. So, like talking about family members or asking for help. And then use it and improve it reminds us that the more patients use their communication skills in therapy and everyday life, the stronger that those language connections will become. So that is why speech therapy is so important because recovery doesn't just happen by resting. The brain needs repeated, meaningful practice to rebuild communication.